Hi, everyone. I am Scott Carney, and I am so happy to be able to bring you this interview with Ashita Batavia, who's an infectious disease doctor and public health expert who I've known for like 13 years. We met initially back in Chennai when I was an investigative journalist, starting to look at organ trafficking markets. And the reason why we're talking now is because we're in the middle of this horrendous COVID-19 pandemic, and she just happens to know a lot about this stuff. She was on the front lines with swine flu, looking at H1, the H1 epidemic, how it spread across the world. She lives in Westchester, New York, very, very close to the coronavirus containment zone in New Rochelle. This is where the National Guard is out there, and there are so many cases. It's where the coronavirus first appeared in New York State, and she works on the front lines at Lawrence Hospital NYPH-Columbia, which diagnosed the second case of COVID-19 in New York. And thank you so much for coming to meet with me, Ashita. This is, I mean, it's sort of horrible to reconnect with you right now because of this, but it's also really nice to see you. And I think the first thing I want to ask you is just, what are you seeing? I mean, you're on the front lines. What are you doing right now?
Yeah, hey Scott, it's so great to see you after all these years. I just want your audience to know that you look exactly the same as you did
Oh, good.
before.
Thank you. You do too.
Thank you, thank you. Yeah, so it is a really weird kind of time to be here. It's a really weird time to be practicing medicine, practicing infectious diseases in this area specifically. It's really hard. I worked last night, and I'll tell you that we're setting up a tent outside the hospital to help kind of manage our less severe patients. We had over a dozen admissions last night to Lawrence, and I'd say about over 3/4 of those were very, very high suspicion for COVID-19. Patients are sick. Patients are all ages and demographics that we're seeing. They're coming in. Some of them have been tested and they were negative and they've still had symptoms, and they're coming back and we're testing again to find them positive, because the tests, as much as we want them, they're not the greatest. They're only correct in making that diagnosis about 60 to 80% of the time, which I don't think a lot of people realize.
Mhm.
And last night was really emotionally hard for us because we were down to our last ICU bed for patients, and that is something that I'm sure if it's been like 12 hours, we may have already run out of ICU beds. That doesn't mean we can't take care of ICU patients. It means that we are kind of using beds for other reasons, which have ventilators, our step down beds, if you will, which are kind of an intermediate level of care. Those are being converted into ICU beds. And the way the pandemic is spreading right now, this is a critical concern for healthcare providers. We don't have enough beds, particularly high acuity beds right now. And that's why this is such a critical thing for me, to educate the community and make sure that we're protected, because there are so many hard decisions ahead of us.
Right. And this is just beginning, you think? Like, this is just still the beginning of the epidemic.
Yeah, this is such a hard statement to say. I like to be a really optimistic and positive person, but we're still in the exponential phase of this. So we're seeing the number of cases double every 3 days, which is heartbreaking. And I don't know that there's much in our arsenal. If you have COVID-19 and you're very sick, we have supportive care, which means we're doing everything we can, but we don't have specific treatments, specific cures. And these are long periods of time that we're trying to support people to get better through and survive. For doctors, it's extremely stressful right now, and nurses and all of our colleagues in the hospital, even down to the people who push the gurneys for us and are essential workers but don't get nearly as much praise, but should, because they're right there with us. We don't have enough masks. We don't have enough gowns. We are really bending the normal time protocol on how we, manage infection control, and the stress is palpable. I mean,
Right.
a
Well,
lot of my
you guys are definitely heroes. I mean, there's no doubt the front line. I mean, you are right there. You're taking the patients in, and without you guys, I don't know where we would be as a country. But the way we first started talking about this, and I had actually posted something on Facebook where based on the information that was available at the time. And honestly, this stuff is changing it feels like every 5 hours we get new huge updates. But I posted that, at the time we were thinking that COVID mostly kills people who are over 70 years old, who had underlying health conditions. But immediately the medical community came in and said that is not what we are seeing. Can you explain who exactly is at risk right now?
Yeah, that's a really great question. And for the record, I was not one of the people that came out and said
No,
that.
they were cousins of mine. Don't worry about it.
Okay, I just want to be clear about that. So yeah, let's talk about the deaths part of it. Okay, so first of all, and I have a cheat sheet here, which is my table from the CDC. It just this is their latest data from March 18th that they just shared out, and I think there's a lot of great information, and I think the CDC is doing a really good job of trying to get information out to us as fast as they can. But you're right, everything is changing all the time. So in China, about 80% of their deaths were in people that were over the age of 60. In the US, we're seeing about 80% of our deaths are in people over 65. So first of all, you were not wrong. Most of our deaths are in people of that age group. And I think what does, however, need to be like a big fat caveat at the bottom of that is that there's an entire spectrum from mild illness to death. And there's a lot of things that are happening that are concerning in the middle. So for instance, people care a lot, I care a lot about the 20 to 40 age group because I'm technically still in it for at least a few more weeks. and and here's the thing, those are healthy Americans. Those are people among us that are in their best health. And yet here's the number. So 20 to 40, between 15 to 20% of them, so close to 1 in 5 with COVID-19 are being hospitalized.
Oh my God, really?
Yeah. So they're being hospitalized, and then ICU admissions are between 2 to 4% in that group. And then you're talking about like less than 1% are dying. But in order to prevent them from dying, that is a lot of healthcare resourcing against one of our healthiest age groups. And those numbers start to bump up as you go up in age. So, I mean, the worst is like, I'm going to look at the greater than, this is why I have the table. I can't remember all of these numbers at once.
Sure.
But the greater than 85, those are the most vulnerable among us. So of the ones that have COVID-19, 30 to 70% of them are getting hospitalized. 6 to 30% of them are getting placed in the ICU, and 10 to a quarter of them are dying.
Oh my God. So, but there is a question here, of course, about testing. Like you're saying, the people who are
Yeah,
diagnosed with COVID-19, but obviously what we're also seeing, I mean, people are saying, don't get tested now. If you feel sick, don't
yeah,
get tested. So these numbers are obviously, I mean, we don't have the sort of vision that, say, South Korea might have right now. I hear that they have crazy amounts of testing going on, but that's not what we have
yeah.
here. So these numbers are a little bit modulated by that statistical change.
Sure,
Um,
sure.
One of the questions that if you have any information on this,
Yeah.
what are the long-term effects I mean, can we say anything about long-term effects from people who might get coronavirus, get hospitalized, and then come out? What does that potentially look like, since it's only been around for a few months?
That's a really nice question. That's a great question to ask. So I think there's a spectrum again here, right? So if you are able to pull through and you're a healthier individual, you've got a healthy immune system, you're doing well, the odds are in your favor. There's no guarantees for anything, but the odds are in your favor. Um, and so there's a very good chance that you weather this well and you go back to your regular life and it's as if nothing changed. So that's one extreme. And then the other is you get COVID-19 and there is an immune response, but there's also the virus itself is nasty. Like it has changes and it'll damage your lungs. But then if you get a super infection on top of it, like if you get a bacterial infection because you've got vulnerable lungs and bacteria, like, ooh, opportunity, I'm going in there too, then you've got a lot of potential for damage and scarring. And this could change your overall picture of health down the road. Now, how many people fall into which part of that spectrum, we still need to figure out, but it's complicated and it's messy. And I'm an infectious diseases doctor, so this is like my moment to put the plug in for getting your flu shot. And everyone's like, we're talking about coronavirus. Who cares about your flu shot? I care about your flu shot, and you should too, because while this isn't the flu, you don't want to be the poor person that has coronavirus and the flu, because then you're really setting yourself up to be in bad shape at the end of this.
Oh
and
my God.
So that's what we're really talking about here.
Mm-hmm.
And also, coronavirus symptoms and flu symptoms can look a lot the same, right? So you want to not be the person who gets really sick from flu and gets cohorted with like a coronavirus patient in the emergency room hallway because we're running out of space, and then you end up with both. Like there's a lot of good reasons to try to take care of yourself. So that's my little flu plug.
What does a mild infection look like? I mean, when this happened, you know, one of the first things that I was like was, oh, I have a dry cough. I am running a small fever. I definitely have coronavirus, because everyone is thinking that right now. And then my mind spins out in a lot of different ways. One, am I going to be one of those people in the hospital? Or two, am I going to develop immunity to this and it's going to be fine? And this is like, these are huge unknowns. So the first question, when I saw Idris Elba's tweet, I don't know if you saw this, he was like, I have coronavirus and he looks fine. He's like, I feel a little under the weather, but I think I'm going to be okay. But he was diagnosed. He had a test that came back that said he had coronavirus. So what is the span? Like, you know, what is the 80% of people who don't have a lot of trouble? What do they look like?
Well, first, can I start by saying Idris Elba is probably going to look good no matter what, right? So I roll my eyes when you say that he was looking fine, because he always looks fine. But I think there is a spectrum. And so, for example, the very extreme of this spectrum is little kids. Now, this is really good news in a very dark picture that for some fortunate reason, the children are basically unaffected. So we know that they're getting infected, but they seem to just be weathering it very well. I'm not a pediatrician, but we haven't hospitalized any kids that I know of, unless there's like a lot of underlying other things going on, like just a regular healthy kid. That's like your best case scenario for infection, because they are getting infected. And this is also part of like the challenge with social distancing. So I'm a mom. I have two very rambunctious children who thankfully are sleeping right now. I have a 4-year-old and a 7-year-old, and they are bouncing off the walls. And I get it. Young mothers are like, hey, I can't just be indoors with these little monsters. However, if you take them out to the park, even though the kids are going to be fine, the kids are like spraying virus everywhere, because even though they're not showing symptoms, they can transmit it out. And that's a problem. So that's an extreme spectrum. And I'm sure there's some adults who have childlike bodies who are able to like take on this infection and not show much in the way of, you know, symptoms, or have very mild symptoms. So that is one extreme. And then the other extreme is ICU and our case fatality rates.
But could it also look like aches and a cold, where you're like, well, do I feel sick? Do I not? And you sort of fight it off? Or is this something where you get it and you're like, okay, no, I definitely have something, even if I'm not going to go to the hospital, I've been here before. Where does it fall for people? I mean, this would be.
Yeah, I think that's a really good question. I honestly am not sure how many people fall into the runny nose aches kind of category. And since we're not testing broadly enough, and people who are at this point generally quite healthy and well and aren't showing too much in the way of symptoms, or just being told to stay home, assume you have it, and just quarantine yourself and protect yourself, it's hard for me to know the answer to that question. So I think it's within the realm of possibility, but I'd be sort of, this is more conjecture than like science or experience at this point.
So nothing's come out of like the Korean example where they have tested like everybody. There's no sort of a data coming from there, or that maybe you haven't seen it, or maybe it's not published.
No, there might be data out there. I'm not going to pretend I've read everything out there. I haven't looked specifically for that information. My interest has been more in the more critical patients. So I haven't been paying attention to what the milder like clinical picture looks like. So I imagine there's probably some flavor of it. I just don't know that I've read it yet. That doesn't mean it's not out there. It just means I don't know.
Fair. What can you say about immunity? I mean, this has been the question that has come up more than almost any other question once I posted this on social media, is how many people, I mean, when you get a cold, you don't get reinfected immediately from that same cold. You have some level of immune learning that goes on. What can we project about what's going to happen with coronavirus? And this is the herd immunity argument, right? This is England's herd immunity question, is that if we just infect everybody, most of them are going to be fine. Like,
yeah, let me can I kind of unpack that question a little bit? So let's take it into this.
Yeah.
So the first part is in my mind, and like if I miss anything along the way, stop me. But the first part to me of what you're asking is, okay, how do I, if I have a healthy immune system, am I going to be okay? Like I get this virus, I weather it, and then I'm good. That's kind of part one. And then part two is like, hey, okay, if it's possible to do that, why don't we just do that and get to herd immunity? So is that fair?
I mean, sure, yeah. I mean, the question is really, but can you get, because usually the way the immune system works is you get infected, then your body learns how to deal with it, and then you're more or less okay. Is that happening with this virus?
So I think it's really hard to say. So right now, there are some people that are optimistic and hoping that you get the infection and then that's solid immunity and then you're not going to get it again. However, what do we know about coronaviruses? So there are 6 of them, and 4 of them are responsible for causing about 10 to 30% of your common cold. And how many of us have had the common cold more than once? So there is something to, and there is data around other coronaviruses where people have antibodies, they've seen them. And then there was like a pretty neat study from a long time ago where healthy people, volunteers had evidence of antibody. They gave them the coronavirus and then some of them got sick. And so your immunity to that can wane over time. So it can last for a year or 2, but then you start to your immune system gets a little bit forgetful for certain viruses, not others. This family of viruses, I don't know. I mean, some of the family members we seem to forget, like members of our own family, and some family members really make an impression. And so whether this one will make an impression on our immune system that is lasting, we're still trying to. So that's part of it. So technically you can get reinfected. We don't know if that's happening or how often that's happening. We're still kind of trying to tease out these pieces of information. So that's the first part of it. The second part, like your herd immunity argument. So there's been a lot of conversation around this. Herd immunity is kind of a cool concept. If just to like kind of recap the concept in case people aren't
please,
familiar.
yes, please.
Sure. Tell me if this makes sense or not, but sometimes I am not as clear as I want to be. Basically, the idea is you have a group of people, some of them are vaccinated or they've had the infection, and so they have, for whatever reason, immunity. And if enough people have immunity in your community or in your environment, then the few people that don't have the immunity, they've not seen it, they've not been vaccinated, they are protected because so many people around them kind of have protection. So it's
right. So the
herd
virus can't spread through the herd as easily.
Yeah, like it's harder for it to infect you. That's the overall concept. Now, the way that they kind of think about what percentage herd immunity is based on like this fancy epi term like an R0. What R0 means is if you're infected, how many people do you infect on average?
Oh, Oh no, you paused.
Oh no, you paused.
Wait,
Wait.
we have to go back a little bit because we broke. Somehow the internet broke.
Oh no, we broke the internet.
We broke the internet. So can we? You were saying we were talking about herd immunity when it sort of like went to RoboCop. Um,
Okay,
uh,
so herd immunity, the idea is that some people are not vaccinated or haven't seen the disease, but enough people around them are, so then they're protected because there's less chance of getting it. Big picture idea of what they're talking about. Now, for coronavirus, the epidemiological community believes that you need about 60% of the population to have either been infected, so natural immunity, or get a vaccine. And the vaccine is like further out, and we can talk about that later. Um, but 60%, what does that mean? So
mhm,
60% of America, I did the back of the envelope math here. So 60%, you assume there's like 300 million Americans, 60% of Americans, you're talking about 180 million Americans, and you've got an overall case fatality rate between like, it's either 1/4% to 3%. So you're talking about, to get herd immunity, the price you would have to pay is like somewhere between 500,000 to 9 million American lives. So suddenly herd immunity, when you contextualize what that means in terms of this disease,
mhm.
it's hard for us to get behind that concept, because while a lot of us will be fine, I don't think anyone wants that kind of, or any death if they can
Mhm.
avoid it, let alone numbers like that.
Well, so given that, what do you think? I mean, what is the sort of game plan going forward?
Yeah.
Because when we first came here, you were telling me that your hospital, we're only like what, a few weeks into this, and your hospital's already getting extra beds. How
Yeah.
far? How
Not just
far?
our hospital, unfortunately. Um,
Right.
yeah, so this is a lot of the philosophy behind. I don't know if you've probably heard like this flatten the curve, kind of,
Right.
people have been talking about that. So the idea behind it is, if you um, if you isolate people or socially distance people, isolate is very different. So if you socially distance, so you keep people away from each other and reduce the transmission risk, then you sort of start to bend down the number of infections that you're getting at any given time, the number of people that are getting very sick, the number of people that need our healthcare resources, and you try to lower that to a number that our health system can handle. Because
Right.
what the true tragedy would, one of many, but something that is very real and palpable for us, is if you are overwhelmed with COVID-19 patients, if you have no hospital beds, it's not like our hospitals and ICUs are empty at baseline. And
Mhm.
so people are going to have to start making heartbreaking choices the way they are in Italy right now. And some of the flavor, and we're not there yet in the US, I don't want to panic anybody, but some of the choices that they make in Italy at the moment, and it breaks your heart, is you have to say, well, I have a vent left and I have two sick people. One of them's in her 80s, the other is in his 50s. Who
Mhm.
gets vent? Who's got a better chance of survival? And that is not what any of us ever signed up to do, because
Right.
my oath is to take care of everyone.
Mhm.
And so that that's what we're trying to avoid by slowing the transmission. And eventually we'll get to some sort of herd immunity. This thing will peter out on its own, or we'll get a vaccine. Something will happen. And these precautions we're taking don't necessarily have to be in place for the entirety of that time. But as we're getting up to the peak, we just want to slow it down so we can take care of as many people as we can without getting overwhelmed and without putting ourselves at risk too. It's in nobody's best interest to have doctors walking down a hallway that is lined with back-to-back gurneys of COVID-19 patients coughing at them. I
Right.
mean,
And medical workers are at the highest risk, right? I mean, and you're seeing younger medical workers getting more
Yeah.
serious conditions. It is truly scary. I have this question though. What is so if we do this, the flattening the curve, if we looked at the Imperial College study that came out, and that was very big news 3 days ago, and maybe it's now old news, I don't know, but
It's still a good one.
so the Imperial College study says basically we remain on some level of social isolation for 3 months now. Then they recommend like a 1 month reprieve and then 3 months back on for as long as 18 months before. And what they're waiting for, it seems, is to get herd immunity by getting a vaccine, right? They're hoping that the vaccine catches up, and we're looking at a 12 to 18-month window, I believe, until a vaccine might be ready. So are what we really looking at here in given the current game plan, are we looking at that sort of time frame where we're going to be doing the social isolation, closing down bars and restaurants and whatnot?
I don't think anybody really knows the answer to that question. And I think there's so many trade-offs and other things at work here. And if we can still kind of figure out ways to get sensible about how to work together as a society, work together, and find I don't know, ways to adapt, because I can't even put my head around that sort of number. And that's one hypothesis for how this whole thing plays out from a person to person standpoint. But dear God, if I have to be in this house with my two kids bouncing off walls for that long, I'm going to have a very different picture of the risks of COVID. I I don't know. I think that this is so unprecedented in our history, and we're borrowing examples from like the 1918 Spanish flu. I
Right.
mean, this is bananas. So I have no idea how this is going to play out. Um, and that's one possible like scenario. And I don't think anybody is ready to commit to that on any level.
Oh, we broke the internet again. I'm sorry for that. You said the last thing I heard you say is no one's willing to commit to that at any level, to the 18-month idea.
I mean, I think we're trying to take it as a society in intervals that we can understand, and we're still hoping to see the curve bend down. And I don't think anyone really fully understands. And we're trying to make smart decisions. Some of them are smart, some of them are less smart. I don't know. We're making our decisions as a society, and like the legislative piece of it and the health piece of it, the intersection there is definitely complex, and I feel like above my
Right.
pay.
But what happens though when this all started in one wet market in Wuhan, right? This was like one person ate a pangolin or something like that, and somehow this crossed the species barrier, and over the course of since what, November it happened. Oh, now it's spread all over the world in some very voracious ways. If we give up if the social distancing works, which we're really hoping it works, all it takes, it seems, is like one person to carry the virus to possibly spark this again.
Yeah, this is I don't know. So our SARS outbreak back in 2002, 3, somewhere in the early 2000s, that also was one of these wet markets. So I think that we have to have more thoughtfulness around how we engage with like the animal kingdom in terms of these particular markets, which seem to pose some sort of outsized risk. And that we're talking about a market in a completely different country with a completely different style of governing and
But
all. We
the,
haven't seen that here.
the question is not really about the pangolin, right? The
Yeah.
poisoned pangolin. The question really is about how infectious this virus is. Is that, it started with basically one person or two people, and then that has blown up into this global pandemic. If social distancing is what we're doing, seems to work. It seems that once you have once we stop, if there's 2 or 3 infected people, or more likely thousands and thousands of infected people, it would just flare right back up again.
You mean this one particularly, or just a new one in the future?
No. I mean COVID-19.
Okay, so I
Or
think COVID-19,
coronavirus, yeah.
coronavirus is here. I don't know whether it peters out, because SARS sort of petered out, right? So that happened, it was terrible. And then we don't really hear much more about it. So maybe this one also will peter out. They're the same family of viruses. Um, so maybe there's something there. Um, and maybe outside of this coronavirus, maybe we get smart. Maybe we know how to be more vigilant as an international community and catch these cases earlier so that we don't see this sort of fallout in the future. And I think there's a lot of learnings to be done. I think that we talk about Italy as an example of a country that's really struggling, could have potentially made different choices along the way to have changed what they're seeing today. The US is still an evolving story, and who knows what's going to happen even next week. But there are other countries out there that face this same threat and somehow managed to,
It's true.
yeah, and they managed to act quickly, decisively, and get a handle on the situation and protect their population. And I think there are lessons to be learned from all of our different human counterparts who've responded in different ways. And there's at least in my heart, optimism and hope that we won't have to do this again in our lifetimes or anyone else's, that we'll get a handle on how to be vigilant for these sorts of diseases and not be in a social distancing situation like this again. Maybe we do, maybe we don't, but this is really unprecedented.
So given where we are right now, what is it that people need to do to keep their community safe? What are the, I mean, we know about social distancing. We've heard that you should wash your hands, right? What can we do from the sort of public health and personally, what can we do to be safe?
That's a great question. I think there's actually a lot of things that you can do to take care of yourself and take care of your community. I think one of the important things, so social distancing, I feel like this is a really confusing epidemiologic term that people don't quite know how to wrestle with because it's kind of badly explained, right? Let's be honest. I mean, social distancing means you can still go out for a walk, you can still go out for a run, you can still go to the park, just try to stay 6 to 10 feet away from the people around you that don't live in your house. Social distancing means, unfortunately, no play dates for your children. And my 4-year-old's trying to figure out how to FaceTime with her friends, which is weird. They just scream at each other a lot. It's very noisy. And it also means, no, you can't have your nanny come in, you can't have your babysitter come in. Like, you really should try to keep separate from other people. And there are ways to do that and be connected to other people. Thank God it's 2020 and we have video conferencing. It's not great, it's not the best thing in the world, it's not giving your friend a hug, but it's better than nothing, right?
Well,
There's
I'm finding actually that one of the silver linings of social distancing is I am talking to more of my friends now than I have in the last year because everyone's calling and texting and wanting to catch up. So in a way, social distancing physically is hard, right? But I'm actually finding that there's a weird community that's showing up because we have these tools online.
And okay, I'm going to use that as a segue to make a plug for something else you can do in your community. So we are, believe it or not, more tech savvy than most. I am shocked to call myself tech savvy at any point in time, but there's a lot of elderly individuals out there where social distancing unfortunately means social isolation. And I think that something that you can do that would be very powerful if you're looking to support your community is to reach out to elderly individuals, to reach out to members of the community who are at outsized risk of a bad outcome and offer to get their groceries for them and offer to leave them on the doorstep for them, offer to just connect with them and be there to show that you care. You can drop off treats. I think those things go a long way to building community, supporting your community, and educating others along the way too is huge. That's how you save a life. You tell your friend to Netflix stream something with you and you both comment on it at the same time, and God knows you can make it work, right? Yeah.
What else? I think I may have cut you off as you were describing the things you can and can't do with social distancing. Can you give us sort of like just a succinct rundown of what this means?
Sure. So it means, so again, you can walk outside and stuff as long as you're 6 feet away from people. No play dates, no playgrounds. My goodness, no playgrounds. Just because those playground structures are very difficult to sterilize and clean. They get used by multiple hands. You don't know when the last time somebody touched them. And we have studies that they've been able to recover coronavirus off of surfaces like 2 days out, up to 72 hours in some studies. That doesn't mean that that virus is capable of causing an infection. No one's proved that yet. But at this point, does anyone really want to take any chances? So that's part of it.
And then those kids can become infectors, right? Even if they may not have a huge outsized reaction themselves.
It everywhere.
It's everywhere. They're like just, it's like preschool all over
Their
again.
faces and noses and everything. Have you ever seen a kid? Their noses are always.
Oh, we broke off again.
What else is social distancing? How about getting groceries? That's something people like. I still need to go get groceries. I still need to go to the pharmacy. I still need to like get gas. I need to go to these places. So how do I do that safely? So, you know, that to me is a really great question. Social distancing doesn't have a footnote to cover that one. So I think the important thing there is to make sure, first of all, that you're not symptomatic or that you haven't been exposed to somebody with symptoms, because one of the other diabolical things about this infection is that there's an incubation period of between like 2 to 7 days. And during that time, you don't feel any symptoms, but you are infectious. Mm-hmm. So you just have to make sure that you yourself are quite safe. And then when you're going out to shop, try to keep at least 6 to 8 feet away from, 6 to 10 feet away from other people. So that means if you're waiting in line to go into the store, then try to wait in line at intervals if possible. If you're shopping, try to think about your necessities and get maybe a little bit more than you would usually to kind of space out your trips so you're not going as often. This isn't a great time to read the nutrition label on every item you pick up off the shelf. Maybe read it before you get to the store and have a sense of what you want to get. And try to be smart about what you do. Some people have been wearing face masks in their community. I think that, you know, at this point we have a critical shortage of N95s. I don't think anybody who's not directly taking care of patients with COVID-19 or with suspected COVID, outside of healthcare workers and people with direct contact and risk, I don't think you should be walking around with an N95. Part of the reason, and this is a personal pet peeve, I've seen a lot of photos across the world of people who are non-healthcare workers walking around with these masks. In so many of these photos, they are wearing the masks wrong. So it is kind of a frustrating and sad thing to see in like the BBC or wherever, and you've got people with masks, you wearing them wrong. I think that, you know, if you want to wear something that covers your face, it's your choice.
Well, we broke up again. We did it. You RoboCopped. 1 second. It's going to reset in a minute. I know. It'll be. So apparently Zoom is a big pain in the butt to deal with. I'm sorry about this. But let's actually move on to the next question.
Sure.
So obviously you know that I've been involved in the Wim Hof method for a very long time. I'm very interested in ways that we can strengthen and work with our immune systems. And and this is something that comes up in multiple ways on my Facebook feeds, is like, how can we, once you get sick, what are the things you can do to either to help yourself so you don't go down to the point where you have to go to the ICU, or preventative, what are the things to make us more robust before we get the virus?
Yeah, those are great questions. So I think in my mind, I don't have a lot of, I don't have a depth of knowledge in this space about immune boosters. I haven't seen a lot of data, and I think there's something there. I think that there are people that really believe in this, and I think there are people that get a lot of benefit from it, and I think there's something there. Now, doing that to prevent infection, it's quite possible that it could work. I honestly don't have data or anything to say otherwise. And similarly, if you are infected, then some of these techniques may have value. Now, the concern that I have is, even if you are, generally speaking, like if you're able to harness these different strategies and boost your own immune system, and you're one of these very fortunate individuals that if you get infected, you're going to have a milder course of the infection, that's phenomenal, because we don't want you in the hospital. We don't want you taking up any beds. We want more people like you. However, the caveat is, even if you're weathering it well, even if you're successfully managing the infection, if you show signs, even mild ones, and there is a concern that you're infected, you can transmit to others. And not everybody around you has the immune advantage that you may have. And so it comes down to just being socially responsible and caring about your fellow person. And if you have milder symptoms, regardless, I think it's imperative that you still reach out to your doctor and make them aware, and understand that you should isolate and protect from other people that live in your home, because you don't want to expose them unnecessarily. If you have shared spaces, try to avoid them if possible, but if you have to be in a shared space, wear a mask, because even if you're not coughing a lot, just the process of speaking, you're creating droplets that could transmit infection.
Wait, just by speaking, you can transmit COVID?
Well, think about what I said earlier. If you are 2 to 7 days before you show symptoms, you're transmitting. You're not necessarily coughing because you haven't got the symptoms yet, but that's why we're asking people to stay about 6 to 10 feet away from each other. Yeah.
Wow. So wait, so just because when I speak, air comes this way, little COVID particles can migrate their way to somebody, and I could.
Particles, like stuff's coming out of your mouth, even if it's not got COVID in it. We are just like, fortunately, our vision is not good enough to see everyone spluttering at us when we're having.
Oh, man.
There's droplets out there.
And thank you so much for saying that, because I did some videos about the Wim Hof method and COVID before, and like, there's no research for what it's going to do with this virus, but and I believe it will help, but you make this very, very salient and important point, is that even if it does work, we're still infectious. This is about public health. It's not about personal health, and that's why these measures are so important to take seriously right now.
I want to call out, hold on, if you're doing the Wim Hof thing and you're hyperventilating and holding your breath, that hyperventilating part has got to have a ton of particles spraying out. Let's be honest.
You're definitely not doing that in public anyway. So,
but you never know. That's not, is that stipulated in the fine print that you can't do it in public?
Actually, that's a good point. People should probably not be doing their group Wim Hof method, but I think that was covered by social distancing. If you are a Wim Hof method instructor looking at this right now, please stop go virtual for a little while, please.
Yeah, virtual. There you go. Virtual piano teachers, virtual. I didn't even know you could do virtual Wim Hof. Okay, maybe we should have a conference call so you can get me up to speed on that.
We'll do that together after this. So I got a lot of questions from readers, and we've been going for a little while. So I'm going to sort of go more quickly through them. One question that came from the part of the medical people who are following me, they want to know when more tests are coming. Do you have any insight into what that might be like?
I hope it's soon. I don't know. I think that they are working on it, but I really don't have more insight into what that means. And I know the healthcare community really would like it. And we'd like faster tests, please, as well. So um, I wish I had an answer to that. I would be the most popular person in the hospital if I had that answer.
So what about this rapid point of care test that South Korea is using? Because that's how they tested their whole population really quickly. Why is that not in the States? Or do you know anything about that? We Robocopped again. Zoom, I hate you. Okay, we're just gonna wait a second. We're gonna wait, and it's all gonna be better in a minute.
Are you back?
I'm back. We're
Okay,
back.
you're back.
Okay, so the question was
South Korea, is that the question?
so the question was they have a rapid test in South Korea that why are we not using their stuff?
I don't know. I actually don't know very much about the rapid test. I'd be curious to see what rapid means exactly. Like, is that still a 2-hour, 3-hour turnaround time? I'm not actually familiar. And I'd also be interested in understanding the how good the test is. So like our sensitivity numbers and specificity numbers, it's like basically how good are you at telling me that a person has COVID if they actually have COVID? Those sorts of things are going to come into play when with something like that. And I have no idea why we don't have it here. I'd love to have a good one that was rapid. Yeah.
No, that's fine. That's fine. So also there are these clinical trials right now with, I believe it's hydrochloroquine, which is an anti-malarial drug mixed with also a antibiotic that has a promising clinical trial going on, I think in France. And then recently Trump said he's going to go release it into the wild in America.
Yeah.
What's going on with that?
So hydroxychloroquine
Thank you.
is you're welcome. So hydroxychloroquine is it's an old drug. It's an anti-malarial. We've had it for a while. There have been a few studies that have come out. Actually, I don't think there's been more than about 3 that I've seen, unless there's something recent. One was a Chinese study. They said they had 100 patients and they saw improvement, but they didn't really explain what exactly improvement was, which is a little bit concerning for me. I mean, if it was really impressive, why didn't you just put the numbers in? There was a in vitro trial that said that it was promising. So in vitro basically means they did it in a lab. They didn't do it with a living organism, and that showed some promise. So that's encouraging. But again, we know it's a relatively safe drug. People get it. There are some people that have
But
contraindications.
there was a human trial though done in France.
France. Right. So I was looking through it. It wasn't that many patients. It seems promising and optimistic. And I feel like I'm all for things like this working, but I also would like to make sure that it actually does have effect and safety across a broader group of people, and that we're doing some sort of more robust testing before we're just giving it out to everybody. That said, on a case-by-case basis, it's at the physician's discretion, and it's a tool in a very empty arsenal. So we'll see how it goes.
So the other thing, so in the broader wellness community that is out there, these are not the doctor questions, these are from the other group. People are talking about all sorts of alternative methods. Some of them to me sound a little crazy, like blowing a hair dryer up your nose to kill the virus.
Wow.
We've
Okay.
colloidal silver, large doses of vitamin C, saltwater gargles. Does any of this, because the idea is that the here's the logic behind it from what I can
Nasopharyngeal
tell.
carriage that we're kind of getting rid of.
That you get it in your nose, the virus comes into your nose, and you want to kill it before it gets to your lungs. So there's various interventions that people are trying. What do you think about that stuff?
I think that it's I think people like to do things. People like to have the ability to do something and think that it works. Does it actually work? I'm not sure. I do have some skepticism about it. I don't think that it's a good idea for anyone to just sit there with a hairdryer up their nose. That sounds incredibly uncomfortable. And I would encourage people to just, you're already stuck indoors. Don't make yourself more uncomfortable. Um, don't 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 necessarily pursue these ideas without really asking some good questions. These are good questions for your doctors, for your friends. I don't think that I'm going to be recommending any of that anytime soon.
What would you say, what is the point where somebody is ill, where they should go from staying at home and trying to manage their illness at home, isolating themselves as need be, and when they should admit themselves to an ER? Where is that shift?
That is a great question. I think that shift is actually, the honest answer is that shift is different for different people. So that shift is something that you should really have a conversation with your doctor about, because for each individual, and I'll speak to like my personal patient experience, some of my patients are healthy people. So they look like you, Scott. Scott is not one of my
Very.
patients. They're healthy, they have no real medical conditions, and they're doing well. And so the answer for a patient like that versus somebody who, and if you, for instance, just have fever and a little bit of, like cough, that's going to be a very different answer than somebody who has chronic lung disease or who has an immunosuppressive condition where I may want to get them in earlier, or based on the number of medications they're on, or just some other proxies for their overall health status. The short answer is there's no one size fits all, and that conversation is really one that you need to have with your doctor who knows you well. And if you don't have a primary care doctor, and everybody should, but a lot of people don't, then that's a great question to call ahead to emergency rooms and urgent care centers. Because right now, they are taking those phone calls, they are doing their own triage, and it's slightly variable institution to institution. So the rules may, in addition to being person specific, may be geography specific, and even in somewhere like New York, depending on what your nearest hospital or emergency room is, it could be a different set of rules. Now, if you are really having distress, if you're having a lot of trouble breathing, if things you feel like it's really not a good, safe situation, they're progressing fast, call 911. Mm-hmm. I don't think anyone would fault you for that. But again, I would caution there's no right answer, and you should talk to your own doctor early in the process.
How, and so we also got a lot of questions about infectivity. How long can you carry the disease and be able to pass it and be contagious without symptoms and after you've recovered? What is the window here that you are contagious?
Yeah. So let's, so again, the incubation period, so the period between exposure, being infectious, and showing symptoms is about 2 to 7 days. It's in that window. If you start to have symptoms, and let's say that you're mild, and that your symptoms start to disappear after a few days, you're very lucky, you've got, a great immune system, everything else, you're doing a good job taking care of yourself. Even though you may feel completely back to normal, you really should wait for 14 days.
14 days, okay. That's a lot, but
14,
okay, great.
14 days, and you should have that conversation with your doctor again. Like I want to be very clear, this is not me giving medical advice to all of your viewers. I'm not usurping your doctor. Your doctor knows you best and should be the one making your decisions. There is data to suggest that there is a slightly longer tail on that. So it could be a little bit past 14 days in some research papers, but the guidance overall has been 14 days.
And how infective is it? What's the, I think it's the R number, the
R0,
R factor?
the
No,
R0, yeah.
right.
So
But what is it right now?
So we are assuming that the R0 is between 2 and 3. And I think some studies have shown lower R0. So it's, take it as you will, but generally speaking, what I've seen quoted in the expert community is between 2 to 3, which means that for every infected person, they are infecting 2 to 3 more people. And if you contextualize in the fact that we are seeing a doubling of cases in 2 to 3 days, like that kind of fits with the picture of the epidemiology, the curves of this thing that we're seeing in the news. And
but we still have no idea of the body, like how big it is. Or it's like millions of people with almost no symptoms and just like a little bit who are coming in, or if it's just mostly we've identified a lot of them. Like we just don't have that information.
We're looking at an iceberg and we don't know what's under the water. Yeah, correct.
That's terrifying. So I think this is my last question. This is my own question, and it has to do with the practice of the Wim Hof method, which you're probably not completely familiar.
I'm not.
So what it involves is hyperventilation and then holding your breath, and hyperventilating and holding your breath, and then you take a cold shower at some other point. You relax in the cold shower. Okay. However, the question is when you do the breathing, it's deep and you're breathing in more than you're breathing out in general.
Okay.
Is there a reason to think that the practice of that Wim Hof breathing might draw more virus into your lungs? Or you think that is irrelevant? It doesn't really matter?
Oh, that is a really interesting question. I don't know that I've actually thought about that. We are careful in general in the hospital when we have patients with a pneumonia or specifically a pneumonia about giving them types of respiratory support where we are pushing air in, which I feel like your deep breathing maybe on some level kind of simulates that. So there may be a theoretical risk. I also, however, what's more front of mind for me with this question is if you have a respiratory process, something like whether it's like a bad cough or whether you're starting to have trouble breathing, it's hard to know what the arc of your disease is going to be. And so if you're starting to have any kind of trouble breathing, I'm not sure that I would recommend doing that methodology on top of it. I think it's more a time to prioritize calling your doctor and trying to understand what their recommendations are, because I would really be pained to see somebody who is in the early stages of a respiratory infection that may or may not get worse. How could we know? Start taxing their respiratory system further. I don't know. Now I'm kind of venturing into a space where there's not that much science and I'm just kind of thinking it through out loud. So this is not.
That's totally fine. And I think that's honestly where most people are with the Wim Hof method right now. I don't know personally. What I would probably do if I did get symptoms is I would practice the breathing. I wouldn't do the cold, but again, I would be experimenting on myself. I would not be saying this is what other people should do.
I think this is where like human autonomy kicks in, and like maybe if it's helping you calm yourself down because you're very anxious. I don't know. Is that part of the Wim Hof thing? I mean,
yeah, that's a side effect. Yeah, there's a whole immune side of this, and we don't need to go into that on this conversation. But there's a book about it called "What Doesn't Kill Us," and I hear it's pretty good.
I hear the guy who wrote it is like kind of a nice guy, right?
Anyway, Ashita, this has really been an awesome conversation, and I very much appreciate you having this time to talk with me. And do you have any last words you want to give to the people who may have still stuck around to the end of this video?
Yeah, how many of them are there? I don't know. I would say from the bottom of my heart, I hope you stay healthy. I hope that you take social distancing seriously. And even if you are, the tippity top human specimen out there, you are unfortunately still able to be infected. And even if it doesn't make you sick, you could make other people sick. And so this is more than just your personal immunity and your ability to persevere. This one is really something where we're in it together. Take care of your community and kind of love your neighbor and be there for the people around you who are vulnerable and really need us to be considerate of them and their needs. Um, yeah, that I think is what I'd like to just leave it with.
So where can we get information? Do people connect with you, or should they just go to the CDC website? Where is the best information source right now?
I think the CDC is doing a damn good job of giving information to people in a clear, concise, and meaningful way. I think if there are still conversations and questions out there, I'm still working through like how I'm going to be able to field all these questions. But maybe Scott, you can like filter them for me, you can batch aggregate, and we can like work together. I'm looping you, I'm pulling you into this.
Oh man. Well,
But
you know, if people really like this and have more questions, and then maybe we can do this again in the future, and we'll talk offline on how if they should connect with you or not. Anyway, thank you so much for taking the time to talk with me. And I know that you are working enormously long days and raising a family and saving the world at the same time. So just thank you.
And thank you for just continuing to write really good books. Keep doing it. Thanks, Scott.
Bye.